So I'm going to go ahead and try to convene our next panel. So one of the themes that we've talked about today is the power of virtual communities, either for massive open online courses, and also for just the power of social media. This panel, which is headed by Kavita Patel, and I'll let her introduce herself, and you can read about the panelists, is going to explore how social media can be used to effect change not only in areas away from healthcare, but actually within healthcare for the better.
All right, thank you, Darshak, and thanks to all of you on the web and live. I'm going to shake things up a bit by standing here at the podium and looking at my many devices at the, we're trending, Darshak just told me we're trending on Twitter, which is a good thing. So for those of you who don't know if that's good or bad, it's a good thing. And as my mother likes to say, like, she gets Twitter and twerking confused. She asked me last night, she's like, do you do that twerking online? And I was like, I don't, Mom. So I know, it'd be fun to see, right? And so I'm going to stand here and try. We've actually been having a lot of, like, interesting traffic on our hashtag Merkin14. So what I'm going to do, because our panel, first of all, their bios that are full and complete and wonderful are in your packets and online. So I'm not going to rehash their bios, but I am going to tell you kind of a little anecdote about each one of them to set up this topic. And I'll start with my friend e-patient Dave, whose birthday was yesterday, but as I said to Dave, it's a month. We decided it's a month-long celebration. So February is the birthday month of e-patient Dave. So happy birthday to Dave. And when I first met Dave, I actually first met. He doesn't know this. I was in the audience at one of his talks several years ago, where he gave kind of his, I think it was before your TED Talk, before you became, who you are now and kind of the fame that you have achieved. And he really just talked about the compact he had made with his personal physician around the care and searching for the best care for his cancer. And it was amazing to me because I wasn't so much fascinated with Dave and his story. I was fascinated by who his doctor was that could actually do something in this kind of concept of participatory medicine, and how his doctor engaged with him, and how Danny really helped to kind of shape what this concept of social media engagement between clinicians and patients can really look like. So I think that it's so fitting that we have him on our panel. I then met Dr. Alice Chen. I thought we met in California at some point when you were there more full time, but I met her more recently in her leadership role at Doctors for America. And they were previously, I hope I'm not saying anything out of school, when you were Doctors for Obama, and I had first encountered you when I worked on the Hill, and I thought, I'm a former American Medical Student Association, AMSA president. We have the current AMSA president in the front row. As a former AMSA president, I was fascinated by this kind of rise in online social movement for medical students and residents and physicians, and this creation around not just our current president, but this concept of like political action and kind of how physicians were getting involved through online means. And then finally, Neil and I met in person today, but I think we've had a relationship online for a long time, and I realize that sounds very bad with my husband probably watching, but Neil's been doing a lot of amazing work through cost of care and taking, I think, what are such, as our panelists this morning highlighted, such difficult concepts and trying to really bring those through online media into a reality that we can all digest. And so my role in this is to serve as your moderator, but I'd love to now, in reverse order, starting with Neil, ask them to make some opening comments. I'm going to station myself so I can kind of see things on Twitter, because what I'll do is break this up. We've had very stately panels this morning, very fitting with the Brookings Institution tradition. I can guarantee you this will not be a stately panel. This will be an exciting panel. So, Neil, no pressure, but let's start with you, right. And then we'll go to Alice and finish with Dave, and then we're going to have plenty of time for interaction and me to break in with breaking Twitter and twerking updates. And if anybody wants to twerk for my mother, we'll make her very happy.
somebody can twerk and we can put it on Twitter.
We could do that. Or we could actually make a con video about how to twerk, which I think is the next one due out of it. All right, now I'm done with the twerking comments, I promise.
All right. Well, I learned this morning that to keep it lively, I should tell a story. So I'll tell you a little bit about my story, and I think the serendipity of how I ended up at the Brookings Institute talking about Twitter.
Can you all hear?
No,
Okay, the mic.
not on the webcast.
Yeah, I was going to say on the web it might be. We'll make sure we can get your mic going, Neil. Shout a little bit before then, and I'll get you a hand mic.
I can be loud, it's okay. So in 2006, I was a third-year medical student, and after about a quarter century in the classroom, they finally let you put on a white coat and touch real patients. And you know, I had this idea of what being a doctor would be in my head, and then there was how healthcare is actually delivered, and they were different. And in particular, I noticed that most physicians have very little idea how the decisions they make impact what anybody pays for care, the patient in front of them, society at large. And you know, in particular, it wasn't just an absence of education. It wasn't the fact that not only were we not taught about costs of care, but the way I was being taught was actively training me to be a terrible steward of healthcare resources. You know, there was this false equivalency between doing more and being thorough. Sins of omission were weighted over sins of commission, which means that, you know, you'd be chastised for, you know, not doing something that maybe you could have done. You would never be chastised for doing something that you shouldn't have done. And anyway, the list goes on and on. So I was a little bit disillusioned. I took a brief leave of absence from medical school. And then I came back in 2009 to finish my training after starting a nonprofit that we gave a very uncreative name, Costs of Care. And in 2009, a couple of other serendipitous things happened. You know, we were sowing the seeds of the Affordable Care Act. Suddenly, a lot of people were very interested in the role of healthcare decision makers in spending. And the social media revolution took off. So the first thing that we did is we understood how people search for information online. We called ourselves costsofcare.org. And it turned out in 2009, depending on the news cycle, this phrase was Googled something between a couple hundred and a couple thousand times a day. And I was an intern, so I had very little capacity. But I had a manifesto online, and we got a lot of attention because when you Googled costs of care, that was the top hit. So the next thing that we did is we leveraged that attention using social media. And our first sort of advocacy effort actually was somewhat similar to what Elizabeth Rosenthal has been doing. We crowdsourced frontline stories from forward-deployed clinicians, nurses, physicians, and patients all over the country with the idea of trying to empower them to think about what they could do to improve the value of the healthcare system through the everyday decisions they make, as opposed to feeling like victims, which is often how physicians feel. And we collected hundreds of these from all over the country. And we specifically asked them to tell us stories, not to give us solutions necessarily, but to tell us stories that illustrate opportunities that are routine, not the $100,000 appendectomy, but the daily lab draw that never gets followed up. And over the last couple of years, we've been able to not only hand these off to a lot of the major media outlets, but you know, the great thing about social media, I think, and it's something that we can talk more about, is I think it levels sort of the communications playing field between everyday real people and pundits. And so one of the outputs of this that I'm very proud of, and I think I'll probably end on this, is that yesterday I got a phone call from the Institute of Medicine that they, for their roundtable in March, they were looking for a patient, a very specific patient, and we were able to connect them with a young woman from Texas who had difficulty affording routine care for her childbirth and had a really hard time shopping around for care that would be affordable. And now they're going to fly her in to participate in a panel and potentially help guide the thinking of the healthcare leadership in this country. So social media has great power, I think, not only to push information out there, but to pull it in.
Great, thank you. Alice?
All right. Hi, everybody. It's so great to be here today at the Brookings Institution to talk about this such an important issue of delivery system reform and how to engage clinicians. So I'll tell a little bit about my story as well. So I am an internal medicine hospitalist. I spend part of my time at UCLA taking care of patients, teaching residents, and the rest of my time as the executive director of Doctors for America in DC. So how did that happen that I'm on two coasts? So I also went into medicine with very idealistic views of what being a doctor would be all about. And discovered once I got there that it wasn't really what I thought it would be. And I remember, one of the things that I love most about being a doctor is sitting at a patient. I'm so old-fashioned. I love sitting at a patient's bedside, holding their hand and hearing about their grandkids and hearing about why it is that they want to hang on until next December so they can go to their grandchild's wedding. And that, to me, is kind of the ideal view of medicine. But in the actual clinical world, I discovered patients like my patient David, who I talk about a lot, who was a guy. He had Crohn's disease. He was being well taken care of by his doctors. He lost his health insurance, and a year later ended up at a county hospital where I was rotating. And the day he showed him the ER, he couldn't breathe. He couldn't walk. He was in heart failure. His kidneys were failing. It turned out his disease had gone out of control. And I sat at his bedside, and there was nothing I could do because he had lost an entire year of care, and he ended up dying in the hospital. And I remember thinking to myself, something needs to be done. I cannot practice medicine in this system anymore. But I knew nothing. I knew nothing about policy. I knew nothing about politics. I did not know how do you get involved. I didn't know that. I couldn't name a Senate committee to save my life. But what I did know was that I was a doctor, and I wanted the system to change. And what I've discovered through work through Doctors for America, I basically ran into this organization online and through a friend, and discovered that there were tens of thousands of other doctors and medical students around the country who felt similarly to me, who wanted to change the system but didn't know how. And what we've discovered is if you look at, so to me, social media is pretty broad. It's Twitter, it's Facebook, it's blogging, it's websites. It's really the technology that brings us together, that takes people who are feeling alone and creates a community. So some of the things that we've been able to do as Doctors for America is really to kind of harness the power of individuals. So, for example, we started a Voices of Physicians project at the very beginning of our organization, where we basically put up a Google map and we said, what do you hate about the healthcare system and what do you want health reform to do? And we just let people comment on it. And we had 1,000 people commenting from all across the country, and we just let those comments be. And it was really an educational experience for us and for the people who are putting their comments in there, that you could see, what does everybody else think? Oh, wait, look, I'm not alone. And then taking that experience of connecting people and moving people to action. So I think one of the great things about social media is that you can take a moment in time and you can bring together people from disparate parts of the country and say, let's take action on this one issue. And I know you're busy, and I know you have no time, and I know this is all very scary, but let's take this one action. There is this one thing that HHS or Congress is working on. Send in a comment and we will take it up to the hill for you. So it's sort of creating the opportunities for people to act, and then creating a community around that so that people can connect on their own and sustain it as a movement.
And last but not least, and those of you who are not, I should say that Dave, those of you who are following Dave on Twitter, he has a nice handout that you can go ahead and talk about this so that he can.
Certainly. This length of time is never enough for me. And I had so many things I wanted to say in response to the excellent sessions this morning. I created a 47-slide PowerPoint and uploaded it to ePatientDave.com. So you can look at it.
That is in keeping with the Brookings Institution theme of having lots of content.
Lots of
slides. Yes, you're doing
good.
Very
I'm
well.
glad you feel that way. So for those who don't know, I am a former kidney cancer patient who was saved by the best of medicine. I am an incredible fan of the best information being available where it's needed. I supplemented that information with information from my patient community at the recommendation of my primary, who said, Dave, you're an online kind of guy. You might like to join ACOR. They have a good kidney cancer patient community. Today, my oncologist says, and he agreed a year ago, I was invited to submit an essay about this to the British Medical Journal. My oncologist agreed to be quoted as saying that the information I got on dealing with side effects and coping with the disease probably contributed to saving my life. Now, some people hear social media and patient engagement as being anti-establishment, who needs science, and so on. That is a complete misconstruing of what's happening here. One of the first slides I have says, social media is like capillaries which can carry nutrients, information, to places where they're needed. Okay? It used to be 20 years ago that all valid information traveled through the well-established controlled channel from the institution on high to the humble supplicant with the need. That still happens, but it is no longer a complete picture. And anybody who tries to plan the future with a 20-year-old understanding of what used to work will be missing opportunities. On the subject of health, and my point here is that social media is a mechanism, and all this is explained in more detail in the slides, is a mechanism by which genuinely valid information can travel from where it is to the person who needs it, and the establishment may not even know it's happening. Now, this is not to say that the establishment is useless. It's not to say that, I mean, I still go to the same doctors, I love them. It's that there are additional sources of information. Now, another point in the slides is something that when people talk about the quality of information on the internet, I always point out what I've learned in my blogging about the e-patient movement, empowered, engaged, equipped, enabled, this 17 years thing. You know, on average, it takes 17 years. When I finally found this IOM paper from 2000, I was astounded to see it's not for all doctors to start using new methods. It's for half of clinicians to start using new methods. So, and the problem in the e-patient movement, we know that the problem is that there's just too much new information being generated. 2,200 new articles published every day. So it is ridiculous to think that somebody comes out of medical school and that's it, they're done. You know, the challenge these people have is how do I, from day to day, week to week, year to year, find the latest? Okay, and this is where the slogan that I evolved, the tagline at the end of my TED Talk was, let patients help. It is not about overthrowing the establishment. It's about realizing Charlie Safran and Warner Slack, two senior physicians in informatics at my hospital, Beth Israel DeAngelis, have been saying all the way back to the 1970s that patients are the most underused resource. This is not just a hearts and flowers and bunny rabbits, oh, let's let patients help. They can hold the paintbrush. All right? We're starting to understand there are real, concrete, specific ways that patients can be valid contributors. We need to develop our methods, and social media is a major vehicle for the flow of that information. I could go on.
Yeah, well, let's do this. So we've had a lot of people chiming in on the Twitter feed. One of the points is something you actually tweeted, Dave, at some point in the last half hour around the patient that Neil talked about from Texas. And I think it's an interesting point about how, you know, your comment was whether or not that patient was actually going to get paid for her time. So in you know, professional standards, everything we do gets measured by time and there's compensation. Mm-hmm. When we're engaging patients, there's often kind of the thought that that's just a free add-on activity. So maybe if you want to say a little more about that, and then Neil, your thoughts and reactions to that, since we're asking not just patients but also clinicians. Sometimes the concept of engaging on social media, these are all just things you do in addition to all your kind of the things you need to do to generate money for yourself, your family, and a job.
Yeah, so for several years, when I first started speaking about patient engagement and patients as contributors of value, a lot of people said, interesting thought, but you know, if this were real, the establishment would be telling us, because of course the establishment knows everything, right? Well, but I respect the work that people did to get to the top of the establishment. But in September of 2012, the IOM published a major report. I'm surprised how many people haven't heard of it. Best care at lower cost, And they identified 4 cornerstones of how medicine needs to improve. And one of them, they specifically said patient-clinician partnerships. And under that, they said engaged, empowered patients. I sent a note to Harvey Feinberg, the president of the IOM, and said, couldn't you have just said e-patients, make it so much easier? But they said that the learning healthcare system must be anchored, not take into account, anchored on patient needs and perspectives. All right? And I understand this. And now I've been busting their chops saying, so how come when you invite a patient to come speak, you won't compensate them for their time? Are we building a cornerstone based on whatever free stuff we can find lying around?
Neil, any reactions, or has that been something you've encountered?
A little bit. I mean, I'm not quite sure how to answer the question, honestly, because there's the operational issue about how do you get people to sort of sign on for the advocacy role of trying to change the healthcare system. And I think, interestingly, when this one IOM example, they were looking for what they felt was a non-professional patient, very specifically, which was part of the strength of what we were doing. And both on the patient side and on the physician side, one of the things that we were able to do is get physicians to identify themselves and associate themselves with episodes of care that went not so great for people, and step up and do that. And I think that so far there hasn't been an expectation about professional compensation around that. That being said, on another level, one ongoing issue, I think, for a lot of physicians, at least in the academic space, which might be slightly different, is to what extent involvement in social media counts. Like, is your
Towards
impact
promotion,
factor
you mean
for
towards,
publications
right.
the same as your clout score on Twitter? If you're spending time blogging, seriously, does that count as a line item on your CV and so forth?
Well, there's been rich discussions about promotion and tenure, even inclusion of, not just blogs, but I mean, even kind of boundaries around the types of articles. So if someone were to actually write an article in the New York Times, that wouldn't necessarily be something that a promotion and tenure committee would review and say that that's included with. But we all know that that's not easy to do, to publish in some of these, to write for a newspaper or a magazine, and yet those are often discarded from
academics. I think
academics.
to the point of trying to think about how we can use social media to engage frontline clinicians,
right.
I think we're starting to develop ways of understanding the potential impact of these new media. And just the way you would look at the impact of like a publication, you can now look at the impact of people's tweeting.
Their clout score.
Their clout score. And there are all kinds of strategies and frameworks underneath that for how to exert influence. I mean, as a resident, my Twitter handle was essentially a small radio station just by being a credible filter of information.
Right, right.
Could I do a little rebuttal, maybe after?
Oh, hold on. Yeah, let me. So I'm still a practicing primary care physician, and it's interesting toggling between the two worlds of Brookings and kind of, as we're all kind of addressing at the front lines. It's incredibly hard for even some of the newest graduates coming out of medical school who are much more comfortable with all the devices and much more facile and even using kind of technology, period. It's incredibly difficult when you come into any system now and there is kind of the daunting electronic medical record as well. I think, Neil, you said it, we were taught to be horrible stewards of resources, but even when people like me who try to be a good steward of resources, we struggle with where the line is between engaging with patients on social media, and part of that is because there is a perception, whether it's for privacy reasons or because you're worried about being accessible 24/7. Has that, Alice, in your work with kind of all spectrums of trainees through physicians who have been in practice for a long time, has this topic come up? It's something certainly that we all are dealing with in our practice, but have you had experience with how to deal with where do you draw the line? Because Twitter, all these things are 24/7. And the most common thing I'm hearing from my own colleagues is the burnout factor, or the feeling that they almost don't want to offer themselves up on social media because they don't want to be accessible to patients all the time. Has that topic come up for you?
I mean, I think I think there's sort of like a couple of sort of issues in there. One is that 24/7 available. I'm always on. I'm burnt out. I just want to go and turn on the TV and watch the Olympics.
People are doing that, by the way.
Nobody's
watching
doing that.
the
I don't
Olympics,
know.
right?
Of course
Find
not.
out everything hours before.
And then the other question is sort of as a physician, as a professional, how do you put yourself out into this public space to talk about issues that are somewhat controversial, and have an opinion that may be different from your own institution or from your patients or from colleagues. You know, I think on the front of how to put yourself out there, I think that has always been very challenging. And one of the things that I think, we've had our members some of our members have been lauded by their institution for the work they do, and some of them have been threatened with losing their jobs over the work that they do. And I think what the power of social media is in creating a community, is in creating sort of a safety in numbers type of thing, where you have, I'm not the only doc out there on Twitter. I'm not the only doc writing in with a story. It's hundreds of doctors. We're all out here, and we're part of this conversation, and certainly not bringing in HIPAA, not bringing in individual patients. But I think sort of creating that space where it is okay to have that conversation is one piece. I think that 24/7, I'm always on. Do I need to continue? Do I need to still be on at all times and be commenting on social media and be a part of the conversation? I think for a lot of doctors, what I found is that there's this weighing of is it going to do anything? Is there going to be an impact? And to me, I think one of the things that social media creates is that dialogue between, we heard earlier that Senator Whitehouse is interested in hearing from doctors. So now doctors who are on Twitter, hey, everybody out there, can tweet at the senator and say, hey, this is my experience. I'm doing a commercial for you over here. But that's a direct line of communication, and they know that my comment is not just going out into the wind, it's actually going to an actual senator who is thinking about these issues. So I think creating those lines of communication between those who are in a position of creating change and those people who have ideas and frustrations and comments and want to connect, I think that's kind of the power of social media. So it's not just one more thing I have to do, it's something that I can do to create change.
And I do think something that should be said, and then Dave, we'll get your rebuttal in, and then if there are questions, we'll turn to both I'm following online, but turn to the in-person audience. I do think that one area that I've heard a lot of, at least in my experience, has also been the non-physicians. So much of this is we're kind of saying clinician, we're dancing around this a little bit, it's doctors. But when you look at, the most amazing people in my office, I don't even have an RN. Primary care offices don't have nurses anymore. We have a medical office assistant and a medical assistant. They actually run the office, and they have probably the lowest pay in the healthcare pay scale to kind of think about perspectives. But they're also much more comfortable engaging and would be an interesting conduit to have more of this clinician-patient engagement. So one of the things that kind of we're trying to work on here at Brookings is how do we expand this concept of who really needs to be engaged in this movement towards ACOs, patient-centered medical homes, and when the patient's at the center, it's not just the doctor. And I think we all say this and know this, but I find in practice day-to-day how for the doctor who's very busy and struggling with where do we draw a line with social media, it's interesting because my medical office assistant said, she's like, a couple of your patients are friends of mine on Facebook, so when you're out, I just went ahead and sent out a Facebook alert, and I thought, I'm not sure we're supposed to do that, but okay, that sounds like but it's a very interesting concept that social media as a tool to run an office more efficiently in an office-based practice when people are struggling to identify ways to engage. So, Dave, you had a rebuttal, and then we'll turn to the audience.
Yeah, on the subject of professional payment, that's not who you want. You want somebody who's completely green, naive, and so on. A couple of years ago, I realized that I have to stop talking about myself as a real patient. For one thing, I'm not what I now call, just to be clear, an actual sick person. I'm not sick anymore. And I realized that once you get to where you have a DC Metro Smart Trip card in your wallet, in the right place so you can just slap it on the turnstile, you're no longer a cancer patient from New Hampshire. Right? You really want that fresh, naive voice. Regarding crap on the internet, so doctors, first of all, my primary published the first guidelines on how to use email and not lose your mind in 1999. Okay, that was 15 years ago. All right, this is not a mystery. And his principle on social media regarding availability and all that is on social media you talk about healthcare, you don't practice healthcare. So it's out of bounds for somebody to ask the doctor a question on Twitter or Facebook. And regarding this thing of crap on the internet, Wendy Sue Swanson, the famous Seattle mama doc, nailed this years ago. She looked at she's a pediatrician and a mother at Seattle Children's. She looked at the people who are coming in with questions, listening to Jenny McCarthy on TV about vaccines and so on. And her realization was terrific. You can tell she's young, all right? There's crap on the internet. It's our job to be out there balancing it with good information. All right, so she does that. There's Mac OBGYN in Texas. He makes announcements like that. I was in Spain speaking a couple years ago, and I met Dr. Casado, who will tweet that he's running behind today.
Right.
And that patients can come back the next day if they want. I said, what do you mean come back the next day? He has time? Apparently in Spain they have enough doctors. I don't know how that happened. But the big thing about Khan, when Mike Painter told me about this a year ago, I just about jumped out of my skin. I get in lots of discussions about people finding unreliable information. Well, guess what? When ordinary patients can get at the same information that med students use to study with, wow, is that going to change the dynamic?
Great, thank you. So I'm following online, but do we have some questions in the audience? And I know we have a mic floating, so right here, or maybe not. Do you want to just, okay, no mic. So just go ahead and stand, and I'll repeat the question.
Hi, Mike Milligan. I'm a physician in residence at the NGA. I'm a physician, but been doing policy work for about 25 years. And I used to blog fairly regularly, not as much anymore. I'm sorry, Paul Levy, you guys can't be here, because we used to blog exchange and talk to each other when I was in Boston. But the question is, with tweeting, not twerking, writing blogs, and all sorts of other social media, can you talk a little bit about the difference between the activity and actually accomplishments of changing something? Because we were discussing before about evaluating with the effectiveness of the Khan Academy and all those things. There's all this noise going out there, but where's the signal?
Let's go. Neil, give us sounds like we would like to have a kind of a tangible, if you look at quality improvement, some relationship between kind of the structure, process, and outcome. A little bit of what's our analogy for that in social media, right? Okay. Neil, do you want to take a first stab?
Sure, I'll take the first stab. I mean, it's not an easy question, even though it's a straightforward one. So I'll try to give you a straightforward answer. But I think, raising awareness is important. So I'll put that out there. The other thing is that, I've been thinking a lot about what Alice said so eloquently about how something about this medium is very validating for people in the trenches. 'Cause that's sort of like what it felt like for me. When you're working in a hospital system where the motto is everything possible, period, and the hospital across the street is until every child is well, period, there's an ethos that you're working within that's different from delivery system reform. And so you can be at odds with your institution, and there's something that happens where it's very validating to connect with other physicians. But I think when you add strength to that voice, it also it's validating to the public and is a way of creating sort of like crowd wisdom and knowledge. So one of the things that we were able to do with all of the information that we'd crowdsourced, most of which is entirely obvious. It's the routine stuff that every physician knows, like this daily lab draw that nobody follows up. We were able to use that in order to develop decision-making heuristics for how physicians, not only, physicians should probably know health policy, but there's a huge gap between macro-level health policy and bedside-level clinical decision-making. And it turns out there are a lot of basic heuristics of how we make decisions that need to be modified in a value-based system that came from listening to the physicians in the trenches that were engaging with us on social media. So I think of that as a tangible win.
Alice or Dave, any additional thoughts? Yes, tangible links, any examples of?
So I think what's interesting about sort of social media and communication in general is that it's a little bit like ripples in a pond. You throw that pebble, and you have no idea where it goes. It's not like when you're taking care of one patient in front of you, I gave you this med, your blood pressure went down. I can see that. That's very tangible. And so I think, one of the things that is important, I think, when using social media and using blogging and Twitter or whatever it may be, is to drive people to action. So for example, we, one of the focuses that we have in our organization right now is getting people to enroll in health insurance. And so we did a bunch of webinars and to educate doctors about how to talk to their patients about this new health insurance marketplace. And what we did was we sort of not just sort of put the information out there and said, okay, now you have information, but we said, at the beginning we said, how much do you know? Are you comfortable telling people? And at the end we pulled them again and we said, are you comfortable telling people where to go? And most of them said, actually everybody said, yes, now I feel comfortable. And then took it one step further and said, okay, now go. Now what are you going to do? Are you going to tell a patient? Are you going to give a talk at your church? Are you going to tell someone about this webinar? What are you going to do with this information? And a lot of people said, okay, I'm going to do something. And they could also see that everybody else was going to do something. And that was sort of, and you don't necessarily know, did they do something, did they not? I was in LA last week and I talked to a colleague who had attended one of the webinars and said, I've been telling everybody. I convinced my gardener, I convinced the guy at the gym to sign up for health insurance, I've been talking to people in my office, and people are actually getting covered. And I wouldn't have known that if I didn't happen to run into her, but seeing that impact, I know that through the webinars that we did, that other people are taking that action as well. I just can't see it in my office, in my clinic.
Dave?
So I asked Twitter, and I got a response from Meredith Gould, who's got some chronic stuff. She says, "Is that a trick or joke question?" She says, "It's radically changed the way patients and caregivers find and connect and support one another." Now, consider Twitter or Facebook is just one way of people connecting with each other at random without centralized control. If you want to see an extraordinary example, look at rawarrior.com, blog run by a rheumatoid arthritis patient, Kelly Young. Phenomenally technical, skilled, scientifically astute, making incredible amounts of things. And remember, the patient community that I joined, see, the drug that I got for kidney cancer, high dosage interleukin-2, I looked at the NIH, National Cancer Society, everyone, and what I saw is side effects are often severe and rarely fatal. And include blah, 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 which is like the State Department saying, warning, there are pickpockets in Rome. It is. It's like, this is what you get when you have science, when you think that facts alone will improve things. So I looked and looked. I said, okay, I might die from this treatment. How do I prepare myself? And I looked, and in all the established sources, there was not a word about it. I turned to my patient community, and I got 17 firsthand stories with a wide range. And as I say, my oncologist says that my being prepared that way may have contributed to saving my life. It's funny because years ago I could have given you far more examples, but that's become such a done deal that. So.
Yeah,
but you can talk to my doctor if you want.
Any other questions while we're getting the mic to Lena, my friend? Go ahead, Lena, and then there's also someone over there. And I haven't.
Senator Whitehouse.
What's our time situation? I have 1 minute. That's good. 30 seconds, Lena.
All right, I will make this really fast. Lena Winters, I'm a physician at George Washington University. One of the criticisms about social media and technology is that it further isolates people from each other, that now there's this computer between the patient and the doctor in the office, but that perhaps may even be increased. And certainly there are examples of patients like you, Dave, or Casey, I see in the audience too, who are very engaged patients. But what about the vast majority of people who are not using the internet for social media and connecting with their doctors? How do you make sure that their interactions are more personalized rather than even more disconnected?
One person gets a brief answer, so we can get another questioner. Who wants to take it? Brief.
Go ahead.
It's a good question, and the best thing I can do is point you to two studies. First of all, Open Notes, which demonstrated at Harborview in Seattle that people without a computer still engaged with their online PHR. And in a related note, Emory just published a paper about a long-term study where they had triple threat patients, low socioeconomic status, and a mental health diagnosis and a chronic comorbidity. And in fact, the patients, again, went online and used the PHR when it was available. I'm just saying that don't discount.
Right. Okay, good. Last question.
Thank you. Jen DeAngelis from Senator Whitehouse. I think the success of Twitter in effectuating change in, say, a retail setting, customer A can tweet at a company and say, I had poor customer service. How that applies in a healthcare setting, there's a lot of issues there. Do you think that institutions of healthcare are able to engage on that level, and are they receptive to engaging?
Well, we know that payers are. I mean, the dramatic example of what Mark Bertolini did with one of his beneficiaries and changing the coverage around his cancer care is probably one of the best examples of a large institution, an insurance company like Aetna, changing beneficiary policy. So, I mean, I would say the short answer is yes. The longer answer is there's a lot, for reasons that everybody's highlighted, it's more complicated, and the implications of which I think healthcare, as many of us have pointed out, it just has so many other regulatory issues that people tend to hide behind them, but you've seen institutions use that up front. And with exchanges, I've seen a dramatic improvement in entities, institutions being able to respond using Twitter as a mechanism to deal with issues. And I think they're learning from other industries, such as the airline industry, the trains, etc. We're all learning from each other, but I see it as a sector change. Any additional thoughts on that topic around kind of how are health institutions responding to this, or can they?
Well, I mean, we're in a service industry like any other, only a lot of our patient-level systems failures don't get as easily highlighted. And I think it comes back to this theme that this medium allows us to level the communications playing field. And I think it's sort of incumbent on us to take responsibility for that, but we're just starting to do that.
Okay, before we give everyone a round of applause, I just want to tie some themes back. There's a very common social concept, the strength of weak ties. What we're seeing right now when we talk about metrics or outcomes, I think we're just as we had looked at kind of social network analysis and how that could influence smoking cessation, use of birth control, and other public health access points. I really think that's what we're going to start to see is kind of connectivity and the strength of weak ties as Twitter and other media kind of play out. And then the second is that I do think that we also need to start moving our research institutions to explore. I find that people's time, Neil, your timeline is a source of data, and the activity and the heights and the peaks and the lows can tell us more about the information that's coming or not coming through, and yet we're struggling so much with patient-centered research and trying to move our nation's research infrastructure. We should be really mindful as we have this conversation about clinicians, how we can pair that with the research effort, because I think we have a wealth of data. So give us a round of applause for our great panel.